Good afternoon, everybody. I just want to welcome you to Lifespan. I'm Anne Marie Cook. I'm President and CEO of Lifespan. And as many of you know, Lifespan serves older adults and family caregivers. It is indeed a pleasure to have all of you here today. And Senator Schumer, it's an honor to have you here to address such an important issue for so many people in our community and certainly so many people in this room today.
Thank you.
As we all know, insulin is a life-sustaining drug, and it's stressful enough to have this disease, you know, Francine, but a person on Medicare can have 4 different costs of insulin during a year based on their insurance. We all know of situations when people are struggling to make their insulin payments and other prescription drugs, and there are hundreds, if not thousands, of stories here at Lifespan of people struggling with this issue. So we're thrilled to have you. We want to thank you so much for being here today. And Senator Schumer, the podium.
Thank you, Anne Marie. And Chris, I don't have the insulin itself.
It's on the shelf.
Oh, it's on the shelf. Okay, I see it. Okay. Okay, great. Well, it's great to be here at Lifespan. I've had a long relationship with Lifespan. Fran Weisberg, when she left political life, came here and really helped revitalize it, and we've been very good friends. And of course, I have a close relationship, although I didn't know it till this morning, with Anne Marie, because her son Andrew does a great job for us, Andrew Cook, as the deputy. He's done a fabulous job. And little did I know that his mother was the CEO of Lifespan until today. He's very modest, very modest. But I thank Anne Marie. She's the CEO of Lifespan. And we have some guests here. I'm going to introduce them. We're going to hear from Jeff Collins. He's the Executive Director of the American Diabetes Association in upstate New York. Thank you, Jeff, for being here. We're going to hear from 3 people who are living with type 1 diabetes. Jane Skinner, right here. Greg Best, right here. And Ann Partridge. Where's Ann?
I don't think Ann.
Ann didn't come. Okay. Erica Dobson, as well, is from the U of R's Medicine Senior Director of Electronic Health Records and former Director of Pharmacy Services. So thank you for being here as well, Erica. And then we have some other people who care about this but who are not speaking but came because they cared so much. We have Francine Camacho, living with type 1 diabetes. Type 2 diabetes. We have Kate Pagan-Kemper, a registered nurse and a clinical care manager. Kate, raise your hand. I don't think I met you. Ah, there you are. Good. Melanie Jones, who I did say hello to. She's a caregiver, and she pays for her son's insulin. And Tracy Foss, who's the upstate director right here of Juvenile Diabetes Research Foundation. Look, we all know that diabetes is one of the most serious illnesses that affect America. In fact, I think it's the 3rd highest cause of mortality, and it's growing. We're making progress in cancer and in heart disease are declining in terms of per capita deaths per year, but diabetes is going up. It affects a huge number of people, and I'll have some numbers here about how many people it affects in the Rochester area, in the Rochester Finger Lakes area. But what are we here to talk about today? The cost of insulin. This little vial is so expensive these days. It can cost $600 a month for somebody who doesn't have insurance to pay for their insulin. But they're not just paying for their insulin. You then need all the equipment to administer the insulin into the bloodstream, the pumps and everything else. I have one of those here too as well. And all the materials, all the paraphernalia. And this chart right here shows that for the average, for so many people, the cost of insulin over the cost of the year, if you're a type 1 or even a type 2 diabetic, could end up being about $13,700. Now, how do families afford that? But this is vital, vital medicine. And so what do you know a lot of people do? 1 out of 4 ration it. That's very bad. They either take half a dose or they skip a dose. And the doctors will tell you, the experts will tell you, that that is going to make them much sicker. And if they don't take their medicines, they get other ailments that, again, are very, very debilitating to themselves and their family and very, very costly to society. So making sure that insulin is affordable is humane and right, but it also is going to save money for our society as a whole. Now, so what am I, when you have to pay, say, $1,000 a month, that's $1,000 that could have gone to the mortgage payment. That's $1,000 that could have gone to new tires for the family car, with some money left over, hopefully. You're not buying that expensive tires. $1,000 for school clothes and lunches. So why am I here? We are announcing a major push to limit the cost of copayment for diabetes to $35 a month for people who have it, instead of the $600 that they would now pay, so many of them. As Senate Majority Leader, you don't have unlimited power with 50 votes, you know that. But one power you do have, one of the powers you do have, is to determine what you put on the floor of the Senate. And I will call for a Senate vote in March to cap the price of insulin at $35 per month. Because so many people need it. The drug is essential for the daily survival of many people gathered here today and thousands in the Rochester Finger Lakes area that they represent. Listen to these numbers, folks. 1.7 million New Yorkers have diabetes. 1.7 million. And there's another 450,000 who have it and don't know it. So that's over 10% of the population. And when you add that up to their spouses, their children, their brothers and sisters, their families, probably close to 1 in 4 people are affected by the high cost of diabetes in New York State and in America. And as the advocates will tell you, here in Rochester and throughout the Finger Lakes, millions more Americans have diabetes, pay more and more for their insulin, or as I said, ration it. So the bill would ensure once and for all that families never have to make the choice of food on the table or insulin in your bloodstream. That should not happen. So let me give you some information. Diabetes, insulin is not a patented drug. It was discovered in 1920-something, you may know the date, in the 1920s by a Canadian named Fleming. So then it's no longer on patent, and he donated the research to the good of mankind. He didn't just lock it up and try to charge more money. But because of the complicated and often unfair ways that our drug delivery system works, the pharmaceutical companies and the benefit managers, people end up paying a huge amount, much more than they should have. And the price keeps going up and up and up. It's gone about 15 to 17% a year for the last decade. And now, as I said, 1 in 4 Americans ration the drug. Ration it. You shouldn't have to do that, especially in a drug that shouldn't cost so much. So my view is this little innocent-looking vial is a crisis. It's a crisis because it's so darn expensive and so desperately needed by so many millions of Americans and so many tens of thousands of families here in the Rochester Finger Lakes area. Okay? Actually, yes, tens of thousands would be right. Okay? So we're demanding action. The groups behind me have worked on it very hard. Let me give you some statistics that show you the high percentage affected. In Monroe County, excuse me, in Monroe County, 8.6% of adults are diagnosed with diabetes. In Genesee County, 9.6% of adults are diagnosed with diabetes. In Orleans County, 10%, 10.6%. In Yates County, 10.7%. And according to the American Diabetes Association, people with diabetes account for 1 of every $4 spent on health care in the U.S. And as I said, if it's not treated properly, it leads to other illnesses, particularly circulatory ailments that are even more serious. So this is really a life and death situation. And it's something we can do something about and do something about rather quickly. As I said, It's not just diabetes patients who face the burden, but their families, their friends, the businesses they work for. So we have a real shot to fix this. It has bipartisan support. And to give the people of Rochester, Finger Lakes area with diabetes, the sigh of relief they've been seeking in decades. And I'm going to do everything I can to make this happen. Thank you. Okay. Now I want to get the right order of our speakers right here. So our first speaker was Anne Marie Cook, the mother of the well-known Andrew Cook. But next we have Jeff Collins, who's the executive director of the American Diabetes Association here in upstate New York. Jeff, take it away. Thank you.
Thank you, Senator Schumer. Anne-Marie, thank you for having us today. The American Diabetes Association is a strong supporter of the Affordable Insulin Now Act, recently introduced by Senator Warnock and co-sponsored by Senator Schumer. And we have been longtime supporters of copay caps on insulin at both the federal and the state level. As was mentioned before, the price of insulin has nearly tripled between 2002 and 2013. And that upward trend has made affording this life-saving medication even more challenging for millions of Americans living with diabetes. The issue was exacerbated by COVID-19, which disproportionately hurt those people living with diabetes, both with respect to deadly complications and loss of income and health insurance. That's why it has been one of the ADA's top priorities to reduce the cost of insulin to patients. We supported the copay cap included in the House-passed Build Back Better Act. That one gets me every time. And our advocates have been hard at work telling their representatives and senators how important a national copay cap would be for people with commercial insurance and Medicare. To date, 20 states and the District of Columbia have approved copay caps on insulin for those in state-regulated plans. We want to ensure that hardworking Americans and commercial and ERISA plans and Medicare have the benefit of this same copay cap. We are pleased to stand with Senator Schumer to support the Affordable Insulin Now Act and urge Congress to act now to pass this critical and potentially life-saving legislation. Thank you.
Thank you, Jeff. Now, by the way, one fact Jeff reminded me, some states have done this already, and it has been, let me take on and off my mask. Some states have done this already, and it's been bipartisan. It's been red states and blue states. And guess which state just did it a month ago? Kentucky. You sort of know why I'm mentioning that, I think. Okay, next we have Jane Skinner, who's a Monroe County resident living with type 1 diabetes. Thank you, Jane.
Thank you, Senator Schumer. I'm very happy to be here today, but less happy about the fact that I have type 1 diabetes. This would help a lot. So as a type 1 diabetic, I can work with my doctor to come up with a variety of different therapies to manage my blood sugars. However, one vital part of every single one of those therapies is insulin. It's not optional. I need it every single day, 24/7. It's very important to have this be affordable for me and for tens of thousands of New Yorkers.
It's probably in the Rochester, Finger Lakes area, if you figure it out, it's probably about 80,000 people.
Yeah.
So it's important for a lot of people. I was very fortunate for the first 8 or so years of my life as a type 1 diabetic. I was on my mom's insurance. Insulin cost me $15 per copay. It was wonderful. It's the same as you might pay for other medications. However, now that I'm an adult and I have my own commercial insurance with a high deductible, I did the math, and my insurance covers 64% of the cost of insulin. You heard what Senator Schumer said. Insulin is not cheap, so covering only 64% and leaving me with the rest, I hit my deductible pretty quickly. It would be very helpful to have this legislation passed because, again, as Senator Schumer said, we have to pay for a variety of other aspects of diabetes care. So having insulin be affordable such that I could then put more funds towards other different types of costs for my therapies and to adequately care for my diabetes would be very helpful. So thank you very much, Senator Schumer, and you have my full support.
Thank you. Well said, Jane. Thank you. And by the way, Jane still has insurance, even though it has high deductible, high copays. A lot of people who have diabetes don't have insurance at all, and then they're paying the full freight. Okay, next we have another Monroe County resident living with type 1 diabetes, Greg Best. Greg, thank you.
Thank you, Senator Schumer.
So I've had type 1 diabetes for 20 years, and it's affected my life every single day for all of those years, as you can imagine. I also live with complex post-traumatic stress, which affects type 1 diabetes in ways that you probably can't imagine. There are days where my blood sugars will be 300 for no reason. Just for a frame of reference, that's pretty high. And it'll affect you on the daily with different bodily sensations, different things that you have to deal with. The one thing that we all have in common is that we all need insulin, whether you're diabetic or not. So if you make your own insulin, yeah, good for you. If you don't, that's why we're here. So think about going to, whatever your store of choice is that you go to on a weekly or bi-weekly basis to get supplies for yourself. And imagine getting to the checkout and they say, oh, this was $50, but now it's going to be $500. I've had that happen to me at a pharmacy. And I remember the feeling in my gut when that reality hit, this was at the age when I got on my own insurance, and I remember thinking to myself, how am I going to keep this up? I have no idea. So I started doing things like changing my diet to have no carbohydrates in it, rationing my insulin, all of these things. I don't think anyone should have to do that, especially if you have multiple things going on affecting it. So I'm really thankful to hear about this. Thank you, Senator Schumer.
Thank you, Greg. These are very powerful stories. They're not embellished or anything else. It just tells you, speaking truth to power. So thank you. And last we have,
Senator, I'm sorry to interrupt you, but I'd like to speak on some of this too.
Okay, in a few minutes, okay? Okay, we have Ann Partridge, another resident living with type 1 diabetes. Ann. Thank you for coming.
Thank you, Senator Schumer. Thank you, everyone here. I have lived with type 1 diabetes for 58 years. Wow. And I would have not been able to live at all without insulin. Since I was diagnosed, the changes that have occurred in diabetes care and management have abounded. We've been much better controlled, much better cared for. Management is easier. But the bottom line is we still need insulin. And I'm lucky I have an employer-paid health program, so my normal insulin costs are minimal after I reach my deductible. Currently, I'm paying approximately $280 a month for insulin. That little vial, I've dropped my insulin before, shattered on the floor, and I have to buy another one? I can't afford this. So there are situations like that that make a huge difference and need to help everyone in the country that's dealing with this disease. The other thing about diabetes is the insulin is expensive, but diabetes also affects every organ system in your body, and that leads to other issues with illnesses and medications needed for that. It's kind of a snowball effect. So if we can get insulin at a fair cost, it will help manage diabetics and keep healthcare costs lower. We're praying for that, and I thank Mr. Schumer for all of his help.
Thank you. And let me just say, the drug companies, even at the low price, will make money. They just don't have to make a huge amount of money on the backs of all these folks, given it's not a patented drug, given it's been around for a long time. And they try to come up with little variations and things, but a lot of the times they do that is just to make more money from some of the folks here, which is a bad idea. Okay, and finally we have Erica Dobson, from the University of Rochester's Medicine's Senior Director for Electronic Health Records, and she's the former Director of Pharmacy Services, so she should know a lot about this, and I know she does. Thank you, Erica.
Thank you. Thank you, Senator Schumer. I'm the former director of pharmacy services at Accountable Health Partners. I have many years of experience working as a pharmacist at the University of Rochester Medical Center, both working directly with patients as well as managing clinical pharmacists that are working directly with patients who have uncontrolled diabetes. Our role as pharmacists is to work directly with the patients as well as the healthcare team to make sure that patients are able to achieve optimal outcomes associated with their medication therapies. Unfortunately, as you've heard today from our patients, this is sometimes hard to do when it comes to diabetes. So many patients require insulin therapy to achieve those successful outcomes. And what we hear from patients when they tell us some of the reasons why they're unable to take the medication therapy as prescribed, it's because of the high out-of-pocket costs of insulin that they are seeing when they go to the pharmacy. We know that reducing those direct costs to patients will help them have access to therapies that are required as life-saving medications. This will improve their health and their safety. When it comes to insulin, and controlling diabetes, if we aren't able to have cost-effective medication therapy that patients can access, it can have both short and long-term unintended consequences. This can include infections, hospitalizations, death, damage to organs, damage to the vascular system, and the eyes, just to name a few. So we're looking very, very forward to seeing the reduction in costs of insulin to patients at the pharmacy, and we thank you, Senator Schumer.
Thank you so much.
Thank you.
Now, did you want to say something, Francine? Go ahead.
Okay, my name is Francine Camacho, and I'm...
You may want to take off your mask if you don't mind when you speak so we could hear you.
My name is Francine Camacho, and I'm a type 2 diabetic, have been for over 40 years. I take two types of insulin. Lantus, which is a long-term, and Humalog, which is short-term. Up until just recently, I have insurance, commercial insurance from my former employer. And these two insulins would cost me $500. Now, this one alone costs $500, and this one is $295. I do not.
That's per month, right?
It's not per month, but it's supposed to last 3 months, but it doesn't.
Got it. Yep.
Because my endocrinologist has.
Yes.
So when I get the bill, I was told, it was like almost $800. To spend.
Thank you.
Because a couple of months ago, I was rationing my insulin.
Yes.
And I woke up and I couldn't see, and everything was black. I couldn't see anything.
Oh.
The only thing I could focus on was a little bit of what my meter would show. My blood sugar, was over 500. Ooh. And I said, and I just kept praying, Lord, just help me. So I took some insulin. I didn't even know how much to take when it was that high. But I took about 30 units of the Humalog, and it started coming down. And, it's like, I don't know what to do now. I'm having still some problems with my vision, but I can basically see. But, to me, I was just horrified when they told me just about $800 just to fill these two.
Yes. Well,
That's why we're happy you're here and sharing.
well said.
Well said.
Did you guys get to see that? Okay. All right, we're going to take questions on this subject. Any questions on this subject? We've covered it all? Okay.
How long do you think that would take for legislation to pass?
Well, I'm hoping to put it on the floor in March. The House has very similar legislation, not exactly the same, and so let's hope we can get this done in the next several months. Now, we depend on getting, support bipartisan, but we're making progress in that regard. Any other questions? Okay, I know you had, go ahead. We'll take one or two off topics. Someone wanted Ukraine, I know that.
Yeah, sir. So with Senator, with Ukraine, what are your thoughts on that? Do you have, and just locally, what can you say to the Ukrainian community here locally?
Yeah, well, what I want to say to the Ukrainian community is we stand with you. I know there's a large Ukrainian community here in Rochester, as there is in Brooklyn. In fact, every year I speak at St. Patrick's Cathedral about the massacre of the Ukrainians at the hands of Stalin from Russia in the 30s. They let close to 20 million people starve to death. They cut off their food. So what I would say is very simple, that President Mr. Putin should know that sanctions will be imposed and they will be strong, effective, and swift. And the President has the ability to impose those sanctions whenever he chooses. We've passed a bipartisan resolution in Congress supporting that. Okay?
Senator, what are you hoping to hear from President Biden in the State of the Union speech in a couple of weeks?
Well, I hope he'll talk about reducing costs. There are a whole variety of costs that are going up dramatically, and in various areas, much of it caused by COVID and by supply chains. And I've said to him, I hope he will address those robustly, and I think he will. Okay? Thank you. Thanks, everybody. We're going to call it there. Okay? Thank you, folks. So I just have to run. Thank you.